to our first presentation of the new year for 2015. My name is Kathy Banks. I'm an instructor in the nursing program here on the Terrace campus. And I'm pleased to welcome Duncan Stewart from the McCready Society, who is involved in the BC Adolescent Health Survey, and he's going to share with us the results that were collected for students in the Northwest region here.
Yeah, totally. Awesome, thank you. Thank you all for coming and sharing some lunchtime with me. I'm super jealous of all the delicious things that you all are eating. That's great. So my name's Duncan, and I'm from the McCready Society. Here's our website, and who we are, if you haven't ever heard of us, is we're a pretty small, independent, non-government, not-for-profit. We're based out of Vancouver, but our mandate is province-wide, and it's to sort of promote youth health province-wide. And what we're mainly known for is the BC Adolescent Health Survey, which is what I'm going to be talking about today, which is sort of our mainstream high school age survey, and I'll go into all the details of what that is. But we also do work to capture sort of the health profile of young people in other populations you wouldn't see in a mainstream public school. For example, we just published over the summer our most recent youth in custody survey, which is a very different group of young people. And right now we're working on data collection on our homeless and street involved youth survey. So that's happening both in Prince Rupert and in Prince George, I think right around now. We're collecting upwards of 1,000 surveys from young people who are street involved. That will also be very different from what we're looking at here today. But what we can do is we do surveys with youth in alternate education programs, all sorts of different things, and sort of really get an idea of what the health profile is of young people across the province. That's sort of the half of the office that I work on, sort of the researchy side. We also have, and I'll share with you at the end, a whole bunch of youth initiatives. We're not just an academic institution who goes and publishes papers and then run away. We like to take the data back and share it with the people who gave it to us. So we do things like this, but we also have a whole bunch of different youth engagement opportunities. If you work with young people, we're trying to give away some money, and I'll talk about that at the end, about some different youth grants that we have going right now. So all sorts of things are going on. So that's who I am, and that's who we are. So as we're going, I'll be going through stuff, but we've got a nice group here, and if you have any questions that pop up, feel free to ask them. If you're watching online, I have no idea if you can do that as we go, but probably not, so sorry. Anyway, so here's a breakdown of what we'll be talking about today. This PowerPoint itself is on our website, and everything that I'm going to talk about is taken from this report, which is also available in full, nice color PDF to download from the website as well. I brought as many as I could carry on the plane with me today, so feel free to take one if this is something that you'd like to learn more about. But don't worry about scrambling on notes or anything. Everything I say is covered in the text. So yeah. So we'll go through all these things around Northwest. So where is the Northwest in terms of what we're talking about? Well, first of all, this is the 5th time that we've done the BC Adolescent Health Survey. It started in '92, and it's repeated every 5 years, grades 7 to 12, and this is youth in mainstream public schools. So for this most recent one, we ended up collecting 29,832 usable surveys from across the province in 1,645 classrooms in 56 school districts, and that was with help of over 325 public health nurses, nursing students, and other trained administrators, one of whom is in the room here with us, and who Kathy was a huge help in making this happen in Prince George. And my hope is that we can work on maybe getting nursing students or local nursing folks interested in the next one in 2018 and going in and doing the administration in schools. It's a really interesting process, and it gets you into schools. So today what we'll be talking about is the Northwest region specifically. So we're talking about Haida Gwaii, Prince Rupert, Bulkley Valley, Coast Mountains, Stikine, and Niska. 2 of those actually didn't end up taking part. There are only 3 school districts across the province that chose not to take part. Every time we do this, we get greater and greater involvement. School districts choose whether or not they want to be involved. So unfortunately, though, 2 of those 3 were in this area, so those 2 are not included in the sample, but all the other 4 are. We ended up getting over 1,000 surveys just in this region, so this is a really nice big sample of students in the area. Because a couple of these took part for the first time ever, Haida had never taken part before, and a couple sort of changes in consent procedures, we can't look at trends across time, even though a few of these districts have taken part pretty consistently. Just changes in participation mean that we can't look at changes, but hopefully if everyone stays involved in 2018, we'll be able to see what's going up and what's going down. And as we're going through, I'll start to talk about what we're seeing province-wide in terms of trends, and what we would probably reasonably expect to be seeing here. Either way, this is definitely by far the most representative survey of youth in this region that's ever been done. So this is kind of a cool data source to look at. So we'll just jump right into it in terms of just sort of the background, who these young people are. Where's my paper's gone backwards already? I got a remote and I got a stack of papers. So, students in the Northwest most commonly report they're of European heritage. This is about the rate that we see across the province, really. Although we definitely saw more Aboriginal students here. If you look province-wide, it's only about 10%. So that's the first definitely unique thing about the picture of young people here. Among the students who identify as Aboriginal, almost all of them were First Nations. About 9% were Métis, and another 2% said sort of other types. The majority of Aboriginal youth had lived on a reserve, and actually a third spoke an Aboriginal language. When we look at Aboriginal youth across the province, it's only about 10% speak an Aboriginal language, so it's really cool to see that language use here, and that's something that we're going to be looking at as we go forward with some other research in the future, hopefully. 4% were born outside of Canada, that's below what you see across the province, and the majority spoke only English at home, and that's pretty typical, but people are often surprised that it's still only 60%. Looking at sexual orientation, only 4 out of 5 students in this area identified as completely straight. Definitely more males than females identified that way, whereas we saw girls more likely to say they were either bisexual or questioning, things like that. We asked about being transgendered for the first time, and the percent in this area that actually said that were so small that we can't ethically tell you what it is, but it was a very small number reported being transgendered. Among Aboriginal students, though, we saw 5% report being two-spirit, which is an interesting new finding as well. Almost all students, 92%, lived with at least one parent. Fewer students in this area lived with their mom, though, than we saw across the province. Looking at sort of other things around home life, we saw males were more likely than their peers across the province to have run away in the past year. But this is pretty typical. A quarter of students had moved from one home to another. When we look at specifically the 3% who are living in government care, we see that those students are twice as likely to have moved in the past year as students who haven't been in care. And we can link that moving to sort of other health problems. You're not as connected to your community, you have fewer adult supports in your community, and we actually saw among government care students, if they hadn't moved, they were more likely to have post-secondary aspirations. So there's all sorts of interesting things around just having a stable home, especially for some of these vulnerable students. This is kind of a neat thing around how young people got to school. 40% used some sort of active means, so walking or biking or skateboarding. 50% got to school by car, and a little over a third used bus or public transit. You can see here sort of the comparisons to the province on the slide. And then I didn't put it on here, but actually we saw 2% of students here actually report that they hitchhike to school usually. So moving on to sort of the physical health picture, we can see that this is really consistent with provincial findings, and kind of it's good to see that most students in this area rate their overall general health as good or excellent. You can see it's a good high number there. It's over 80%. Most students are doing pretty good. Most had also gone to see a dentist in the past year, which is also pretty good, although there was a small number who said they hadn't been to the dentist ever. And we saw this interesting relationship where the longer it had been since they'd been to the dentist, the more likely it was that last visit was for some sort of pain, which is interesting. Asking about sort of accessing medical care in general, though, we saw 11% of students hadn't gotten medical help that they felt that they needed. And this is really interesting. We're seeing sort of the most common reason is a pretty youthy one. It's just kind of, well, I just thought the problem would go away. But the second most common reason is not wanting their parents to know. And when we get into medical or mental health care, that'll be even higher when we look at missing out on care. So it's really interesting to see some of the stigma associated with maybe accessing help. Girls specifically were more likely than boys to say that they hadn't accessed care because they were afraid of what the doctor would say or do, or because they didn't know where to go. About a third of students had at least one health condition or disability. Overall, we saw sort of similar rates for males and females, except for when we looked at specifically mental health conditions, where we saw that females were more than twice as likely as males to report a mental health condition. And when we look at all these students who had a health condition, for about a third of males and half of females who fell into that group said that their condition at least sometimes stopped them from doing things that their friends and peers could do. And actually it was 7% found that their condition just always prevented them from doing things. So there's definitely some debilitating health conditions that have to be taken into account. The National Sleep Foundation very optimistically recommends that adolescents get between 8.5 and 9.25 hours of sleep every night. In this area, about half of students reached that goal. 6% slept actually for 4 hours or less. And this is what we see across the province. It's about 80% of students, so pretty much 4 out of 5, were doing something like either using technology or doing homework or something like that after the time they were supposed to be asleep. Now I'll get into the technology bit in a second here, but the shame of it is that you can really see, and this works for across the province for every group, vulnerable, mainstream, everyone. Every hour of sleep that they got, the better their mental health profile was. It's a really nice, pretty correlation. It's great. It's effortless. It's just every hour the line goes up a little bit more. Looking at nutrition, almost all students ate at least one fruit or vegetable. I know that's a low bar, but at least one fruit or vegetable the day before taking our survey. And we're seeing provincially this is going up overall. Like this tends to be something that's getting better. When we look though at this area in particular, we definitely saw comparisons to the province where that weren't as good. Students here were more likely to have had fast food yesterday, pop, soda, as well as energy drinks. Although on the other side, they were also more likely to have eaten food that was grown or caught by them or their family. There are definitely some benefits of nutrition that we saw. Eating fruit or vegetables 3 or more times was linked to better mental health. There's also, these students also just reported being happier more often. The other side, this is overall pretty positive. We saw about 9 out of 10 students never went to bed hungry because there was insufficient money to buy food at home. The flip side of that would be the 8 or so who went to bed hungry sometimes, and there was 2% of students in this area who reported doing so often or always. And that's definitely one of our biggest risk factors and a proxy that we have for poverty when we look at some of our more advanced stats. 15% of students reported never eating breakfast. Only about half or so always ate breakfast. Definitely males more likely to always be eating breakfast. Some other sort of physical health stuff. In the past year, about a third of males compared to only a quarter of females were injured seriously enough to require medical attention. This is similar to what we see provincially. Most injuries also are occurring, not surprisingly, while they're playing or training for sports, things like that. We did see a very small number who reported that they were injured while using their electronic devices, which I always imagine as being pretty funny looking. About 2/3 are always wearing their seatbelt. We're seeing this gradually go up all the way across the province. You always think it's going to be higher than this, but it's about 2/3. Only 1% said that they never wore their seatbelts. That's good. And about a quarter of students always wore a helmet when they were riding their bike. This is again probably lower than you'd like it to be. Almost 2/3 do when snowboarding or skiing. You just tend to see sort of injury prevention behavior being prioritized more with some activities than others. Though definitely using a helmet, we can link it to lower rate of concussion, lower rate of injury. So there are not surprisingly, benefits to wearing a helmet. We also saw that among students who had ever tried drinking, 7% had ever driven a car after drinking alcohol. Is about what we see provincially as well. And across the province, it's more common to see students who have been driving after using marijuana. It's almost double the rate of those who have been driving after drinking. 8% of students who had ever tried marijuana drove after using marijuana in the past month. I sort of mentioned it briefly there. This is the first time we asked about concussion, so it's definitely an emerging health thing. And the rate, I think it surprised me, I know, to see that almost 1 in 5 students had experienced a concussion in the past year. And this is what we're seeing just across the whole province overall. This is pretty typical. The most common symptoms were headaches, as well as dizziness or balance problems were frequently reported. What's also concerning is that, mirroring what we see pretty much everywhere else, almost 1 in 5 students who had a concussion didn't go on to seek medical help. So again, when we were able to do it, when we were able to take all 30,000 surveys and look at sort of why that might be, we're definitely again seeing some of the stigma around adults wouldn't take me for help, or not wanting to know what the doctor said. So there's definitely some work there to be done with concussions, and I think that's one of the ones that'll be really interesting to see again in 5 years. Looking at body weight, this is, I think, one of the areas of concern that I would highlight when we compare it to the province. This is one of 2 or 3 where I think that definitely we see fewer students here falling into the healthy weight category, more falling into either being overweight or obese. And then when you look at even just among the healthy weight students, we see some really interesting gender differences around body image. Healthy weight females were more than 3 times as likely as healthy weight males to think that they were overweight. We also saw a quarter of healthy weight males trying to gain weight, and half of healthy weight females trying to lose weight. So we definitely see, even among the students who fall into the healthy group, some concerns around body image. And that's definitely not unique to this area. Am I going too fast? Is this good? Everyone? It's a lot, and it's a lot, but I want to share everything. About a little under a third of students had ever had oral sex. 1% more had ever had sexual intercourse. And this is very common. We see when we look at the age that students have first had sex, it was definitely this 14 or 15 age range is when it's most common to first do that if you're going to. So if you're looking at maybe planning an intervention around safe sexual practices, I would think maybe that would be a good age range that you might want to think about. Among all the students in this area, 3% had ever been pregnant or caused a pregnancy, 2% had ever reported a sexually transmitted infection. This pregnancy rate is a little higher than what we're seeing provincially, but some of the safe sex behaviors is pretty much what we're seeing everywhere else. This condom rate, 69% of students used a condom last time they had sex. That's pretty good. The other hand, I guess, would be about a quarter had used drugs or alcohol the last time, and we know that could definitely be linked to some more risky decision making. So looking at mental health, I think I sort of shared this at the start, the overall health ratings. Most students feel like their overall health is pretty good, and most students also feel like their mental health is pretty good, although it's notably lower than the sort of the general health ratings. Still, most students reported a lot of positive mental health indicators. They felt that they were good at something. Most saw a positive future for themselves. They saw themselves having a job or a career. They had positive future aspirations. What was really striking around the mental health section, you'll see this as we go through the slides, are the gender differences. Males were more likely to fall into this good or excellent category for sure. They were also more likely to have higher self-confidence, more likely to feel competent. Males also were more likely to feel calm, at peace, and actually we saw males more likely to report being happy. And then you can see the gender differences really continuing here when we look at some of the sort of the commonly reported mental health conditions, things like depression, anxiety disorder, ADHD, addiction to alcohol or drugs are all things that we saw most commonly reported here. Females more likely to have the first two there. We saw males more likely to report ADHD. Most students, it was like 4 out of 5, had at least some stress in the past year. About half had experienced sort of some level of despair as well, feeling just sad or discouraged. But when we look at the extreme levels, the sort of the stress or the despair that it starts to really interfere with their lives, we can again see really stark gender differences here, with females more likely than males to report these extreme levels of mental health concerns. I mentioned also that we sort of students who are missing out on the mental health care that they think that they need. It's about 10%, but females were over 3 times more likely to miss out on necessary mental health care. The 2 most common reasons, again, thinking or hoping the problem would go away, but 1% below that, it was almost more likely that students would report that they didn't get mental health care because they didn't want their parents to know. So definitely some work around stigma and accessing care that need to be done then. Some other pretty significant gender differences when we start to look at things like self-harm and both attempting and just even considering suicide. We can see here the rates for males, 10% had cut or injured themselves on purpose without intending to kill themselves. A similar rate had seriously considered suicide in the past year. 7% had attempted suicide in the past year. When we look at the rate for females, though, 3 times as likely to have self-harmed, more than twice as likely to have considered suicide, and almost twice as likely to have attempted suicide in the past year. So some really significant gender differences there. We can also know that a known risk factor for attempting suicide yourself is having a family member or a close friend also attempt or die by suicide. And for 22% of students in this area, they reported that a family member had tried to kill themselves, and over a quarter reported that a close friend had attempted suicide, 16% in the past year. And you can really see here it's quite a staggering risk factor when you look at those who had experienced both compared to just one or the other or neither, and how that relates to your own thoughts. Moving on to substance use. Yeah, question?
Yeah, I work a lot with Aboriginal youth.
Yes.
And I'm curious about, would you break it out for the Aboriginal youth with respect to mental health? Because I see, we work mainly with Aboriginal youth who have a lot of mental health or at-risk behavior.
Yeah, definitely. So we don't compare Aboriginal students to non-Aboriginal students. What we do is, for every survey that we do, we we bring in an Aboriginal steering committee to write a separate Aboriginal youth health report. It's called Raven's Children. And we've done 3 of those after each of the past surveys. We're right now really trying to pull the funding together to do the 4th one on this data in the next year or so, we're hoping. I can tell you from the last survey, definitely. What everything that you said sounds about right. We're seeing definitely higher levels of mental health concerns for sure. But we're hoping to get the money and to look into the Aboriginal youth across the province soon. We're working with the Aboriginal Health Authority. We're sort of trying to negotiate with them right now. So hopefully we'll have something for you soon. So I mentioned that the weight was one issue where I would be concerned compared to the province. Substance use is also one where the students in this area are pretty consistently higher than what we're seeing provincially. We'll start with tobacco. About 1/3 of students have ever tried smoking. And we're seeing students in this area are definitely starting to smoke at an earlier age than across the province. We can see 32% first starting at 12 or younger, and then only 37% waiting until 15 or older. It's almost half when we look at the students across the province. What's interesting though is that's pretty typical. About half of students who had smoked in the past month, suggesting that about half of those who have tried smoking, it didn't really take for them, but yes.
Are you comparing those across Canada as well?
We don't actually have many people to compare to across Canada. I would be really interested to do that, but there aren't a lot of other provinces that do what we do. Manitoba has something quite similar, and I think we'll compare to them moving forward. And a couple of other surveys are here and there. The Atlantic provinces have a drug use survey as well. So we haven't had time to we don't really have a similar thing specifically. What's interesting is to see our provincial trends around substance use are, for the most part, everything's going down. And that's certainly something that's being seen elsewhere. No one believes us when we say that students are less likely to be smoking or drinking or doing drugs than they were 5, 10 years ago. But when you look at, there's even a survey in New Zealand that's quite similar to ours that's 1 year ahead of us. So they released their big report about 2 years ago now, and they found exactly the same things around substance use where it's going down. So I couldn't tell you compared to a lot of the rest of the country, which is too bad. We're hoping to actually get up and start doing a survey in the Yukon soon that would be very similar to this, but then we could kind of do some neat comparisons and stuff. But
Have you seen much of a difference since the smoking cessation program started in BC?
do you know what year that was?
No, I'm not too sure, but
it's-
you know.
It's been going down since '98.
Oh, wow.
It's been going down really gradually, or consistently, I should say, since '98. It's very cool to see that fewer kids are smoking than ever before. Yeah. One of the good news stories around tobacco use here, though, is that students here were more likely to have successfully quit than the rest of the province. And that's not just among all students, that's among smokers. So there are definitely some benefits being seen to things like smoking cessation programs and stuff. They are seeming to be working in some cases. About half of students had ever tried drinking. And then among those we see, again, students maybe starting a little earlier than we're seeing across the province. Because definitions for males and females for binge drinking are different, it's a different quantity, we can't call this binge drinking, but for the most part you can imagine as being binge drinking, which is having 5 or more drinks in a short period of time. And we're seeing that about half of students who have tried drinking binge drank in the past month. And when we look at use of alcohol last Saturday, we ask a specific question about what did you drink last Saturday. About a third of students in this area drank last Saturday. Among that group, 3/4 of them had mixed different types of alcohol, which is risky, and a similar rate had been binge drinking. And all of this sort of fits into a picture we're seeing where, yeah, we're seeing substance use go down, we're seeing fewer students try drinking, but those who are going for it. They're drinking to excess. So it's interesting to see sort of that pattern emerging. Really similar around marijuana. More students have tried marijuana than what we're seeing in other areas, and then a lot using before their 15th birthday. But then again, this is again what we're seeing close to the province is about a little over half had used in the past month, and so 40% hadn't. We asked one question: if you ever want to get students to not answer a question on a health survey, I suggest asking them, where do you get your marijuana from? They will not answer it. You can build up all the trust that you like and go in with nurses and positive relationships and kick the teachers out and confidential and everything. They will not tell you. But among those who did tell us, we saw it was most commonly another youth outside of their family was their source for marijuana. But it was really funny to see just the number of students who skipped that. More funny than useful, maybe. When we look at sort of all the other substances that we asked about, these are pretty much like what we see across the province. The only difference was we saw males more likely here to use mushrooms than males across the province. But otherwise, this is really what we're seeing everywhere. And for the first time, we asked students, well, why? Why are you doing all of these drugs? And definitely the most common reason is wanting to have fun, but I think that some of the gender differences here really sort of speak to some of the mental health stuff that I was talking about earlier. Females more likely to not only fit into that wanting to have fun, also though, because they felt down or sad, and also because of stress. We saw that was more common for girls to report that that's why they were using different substances. Males were more likely to report that they were doing it because it would help them focus, which is interesting as well. Moving on to bullying, we asked about bullying experiences specifically in school or going to or from school. We saw in the past year a little over a third of students were teased to the point where that made them feel really bad or uncomfortable. Similar number were socially excluded, kept out of things by their peers. Definitely more females than males reporting both of those. About 9% were physically attacked or assaulted, males more likely to report that. These are all similar to what we're seeing provincially, and we're seeing, despite all the efforts, in some cases these are going up. So definitely an area of concern across the province. There are some effects of this bullying. We saw students who had experienced these sort of things. They were more likely to report missing class in the past month, and they were also more likely to not be taking part in extracurricular activities because they were worried about being bullied there. And for the first time we asked about not only are you being bullied, but hey, are you a bully? And in the past year, 12% of students had teased someone, 14% socially excluded, and only 4% of students in this area reported actually physically attacking or assaulting someone else. What was really interesting though is there's a real clean link between those who experienced that and those who were giving it back as well. If you were teased, you were more likely to tease others. And there's definitely a real cumulative effect to that as well. The more types of bullying you experience, the more likely you are to bully others. It's a real nice cumulative graph there. The other type of bullying is that we asked about is online. 17% of students were cyberbullied in the past year. Again, 3 times as many females as males, while 8% admitted that they had been a cyberbully. This is also a barrier to participation. We saw about a quarter of students who were cyberbullied did not participate in extracurricular activities, compared to only 5% who weren't, so we definitely see that affecting students' engagement in their community. And just another gender difference, that females were almost 3 times as likely to have met someone on the internet who made them feel unsafe. Just a quick breakdown here of the different discrimination experiences that young people had. We definitely saw students in this area more likely to report being discriminated against because of their race, as well as just being seen as different. And then similar to the province, we saw 16% of students had been physically abused, 14% had been sexually abused. This included not only students who explicitly wrote down that they had been sexually abused, but we also asked if you'd ever been forced to have sex against your will, or if we could look at the age that they first had sex and the age of their partner, and we could determine who was actually illegally too young to have sex at that point with that person. And so when we added all those up, it was about 14% of students had been sexually abused. And for both of these, we definitely saw more females than males as well. There it is. 3 times as likely. Just to sort of bring the mood up a little, most students felt like they were part of their school. They were happy to be at school. They felt safe there. The majority felt that they were treated safely by school staff, that they got along with their teachers, that their teachers cared about them. Actually, over half of students in this area also reported that staff just other than their teachers cared about them, which is a pretty good number actually. And when we look at just sort of locations where students feel safe at school, you can see these are all pretty high numbers. Most students really felt safe at most areas of their school, and it was both males and females. So that's really good. 2/3 of students had missed class on at least one day in the past month, most commonly because of illness. Although we saw some interesting gender differences when we looked at some other things. We saw females more likely to miss class because of being bullied, males more likely to be missing class because of work obligations. We asked sort of what their educational aspirations were. Only 1% of students in this area thought that they wouldn't graduate from high school, which is really positive as well. We saw more students in this area than across the province that were reporting that they just didn't know what they were going to do, or they hadn't really thought about their school plans. We also see students in this area more likely to be working at a paid job, which is interesting. Over 1/3 of students had worked in the past year, and this is grades 7 to 12, keep in mind. We also saw students in this area who were working more likely to be working longer hours. 14% of students who had a job worked 21 or more hours a week over the past year. And you can see, and this is not surprising, as students get older, they're more likely to have had a job. But you can see here, even among these younger students, that there's definitely still students who are working. Looking at physical activity, the physical activity guidelines are much like the sleeping ones, I think, optimistic. Students aged 12 to 17 are expected to exercise for an hour every day of the week. Not all students accomplished that. 22% of males, 13% of females had exercised for an hour every day in the past week, which is actually pretty good. Younger students more likely than older ones. Once you hit 18 years old, thankfully your recommendations completely change. At that point, you're only expected to exercise 180 minutes in a week, and so that's about 3 hours, or 3 days, 1 hour a week, and we see students reaching that goal much easier. When we looked at, students in this area were about on par in terms of being involved in informal sports, so things without a coach, so like road hockey or biking or things like that. But we definitely saw fewer students here involved in these sort of organized sports or doing things like yoga or dance classes or things like that. And when we asked why, the most common reason was just being too busy. This was definitely across the board the reason why students reported not being involved in things. Although, for about 1 in 10 students, not being able to afford to was the reason why they reported not taking part in things. That's actually lower than what we see provincially, so that's good news, that's not as much of a barrier as it is in other areas of the province. The two that are higher than what we're seeing provincially is that the activity wasn't available in their community, and also being worried about being bullied is a little higher than we're seeing in other areas. And then technology use. It was so hard to design a survey that took 6 months to write, a bunch of months to print, and then to get out in schools and then not have the technology questions look super goofy and obsolete. Everyone's like, well, I don't know what MySpace is. So instead of trying to get at sort of like hours spent using technology or all these sort of things, we tried to really keep it pretty basic and just sort of look at what sort of access students had and what they were doing. One of the things that I'll come to that. Almost all students had a cell phone. This really isn't a surprise. And I mentioned earlier, 83% of students were using technology of some sort when they were supposed to be asleep. Definitely that's getting in the way of students getting the sleep that they need. So there are those remaining small group of students who don't have a cell phone. And they're kind of a unique group. It's 12-13% in this area didn't have a cell phone. Students who didn't have a phone, they were less likely to have self-harmed in the past year, and we saw a real link to them actually getting more sleep. So those are the students who don't have a phone. On the other hand, the students who do have a phone, they were more likely to have these connections. They had higher rates reporting that there were supportive adults outside their family, so supportive adults in the community who they could talk to if they needed help. So it's kind of interesting to see sort of the relationship between those students who had a phone and didn't have a phone. So that's sort of a lot of the stats and stuff. What I wanted to finish off with is sort of sharing some of the protective factors that we've identified in terms of, okay, well, some of these things, we've seen some of these risky behaviors, we've seen some things that we're a little worried about. What are some things that we can promote to build the health profile up? And most of these things that I'll be sharing, in fact, all of them, not only apply to all students in this area, these are specific to this area, but also to a lot of the vulnerable groups that I've highlighted throughout the presentation. I'll pick out some examples as we go. So first of all, if you've ever read a report that we've ever published, school connectedness and positive family relationships are the two protective factors that come out always. They come out for every group of young people, and especially school connectedness. When we see the absence of the family relationships, we really see the importance of school really and those relationships and that support as really being very protective. So for example, if we take students who've been bullied, if they felt connected to their school, they were more likely to have positive aspirations for the future than those students who were bullied but didn't have that connection to school. We have a whole bunch around positive family relationships and different ways that can be linked. Most students in this area did feel like their family paid attention to them, that they had fun together, good, strong family relationships. And some of the kind of neat things that we saw when we looked at eating a meal with a parent, and most students in this area, about 3/4, reported eating an evening meal with their parents most of the time. We saw that not only linked to things like good nutrition, which isn't as surprising, but also to like safety behaviors. Those students are actually more likely to wear a seatbelt if they felt like they had connected to their family. And we also saw more likely to have better mental health. We saw more confidence in themselves and their abilities. About 71% of students report that the parents always knew what they were doing with their free time, and obviously that can be a bit of a double-edged sword. You don't want to be feel as if you're smothering, but at the same time, we saw real links between kids whose parents knew what they were doing and students who weren't on their phone or on the computer after they were supposed to be asleep. So kind of an interesting relationship there. But it's also adults outside the family that can have a role to play. Females in the Northwest, in this area, were more likely than those throughout BC to have an adult outside of their family that they felt that they could confide in. I think that's a really strong protective factor. These students were more likely to feel like they were part of their community, they're more likely to feel good about themselves, and they're more likely to feel good about their abilities. We also saw students in this area more likely to just overall feel like there was an adult who cared about them in their neighborhood or their community, and it was higher than what we saw provincially, so we definitely see that's a real positive. And then just in general, having someone to turn to for help in general is definitely protective. Most youth who are looking for advice or support, they approach their friends, their family first, but they also look to a range of professionals in their lives. They were talking to their teachers, their school counselors, their doctors, their nurses, their sports coaches, and for the most part, those had positive associations. When we look at students who are vulnerable, though, an example in this area would be when we take those students who are physically or sexually abused, those who asked a school counselor for help, were less likely to find it helpful than sort of students who hadn't gone through that experience. But if they did find it helpful, there were a lot of positive health outcomes. We saw lower rates of self-harm, for example, among these abused kids who had sought help from a school counselor and found it to be helpful. So it's the role of professionals throughout their lives is really important. A couple other ones, peer relationships. No surprise, as young people get older, their relationships with their peers become more and more important. We actually looked at how many friends they had in their community, and having 3 or more friends really seemed to be a really just sort of a nice level where if you have that, a lot of better health outcomes there. And also just having pro-social peers, friends who would be disapproving if you were doing something antisocial. So, for example, if your friends would disapprove of you getting drunk, you are less likely to go and get drunk yourself. So it's peer pressure can be used for the forces of good as well, I guess is what I would say there. I sort of talked about nutrition as we've gone through here, but definitely the importance of having 3 or more fruits or vegetables when we saw a link to mental health. Feeling engaged and valued. It's not just enough to be taking part in activities. It's also important to feel as if you have a voice, feel as if the activities you're taking part in are meaningful to you. And we saw for the most part students in this area felt pretty connected, and these students definitely we could link that to better health outcomes. And then stable home, I mentioned this at the start, especially for youth in care. Those who hadn't moved in the past year, more likely to have positive future aspirations, to see themselves in post-secondary education, which is really something that's being pushed right now. So some good stuff happening there. And just a few that we've identified for the first time from this new survey. I've talked a lot about sleep already. Neighborhood safety, definitely students who felt safer in their neighborhood either at day or at night were more likely to be out and engaged in their community, more likely to be taking part in activities, more likely to be active and doing sports. And this is linked to both community connectedness and cultural connectedness, which we also saw as protected for the first time. And ties into those supportive adults. It all sort of ties together in a pretty clear picture, I think. And we definitely see some really positive outcomes, not just for students who are doing well, but also for students who are definitely at risk. So, just because I know we're running out of time here, just sort of in summary, I would say for this area, students in the Northwest are, they're rating their health pretty good. The majority feel good about themselves. The majority could say something that they're good at. Like just this sort of overall good picture. It's happening. Most kids are doing pretty well. The areas of concern that I would say, definitely the differences in mental health between males and females, the higher rates of substance use, and the BMI data would be the 3 things that I would sort of pick out as being sort of the points of local concern. But Definitely some of the protective factors that I talked about just there can help influence healthy decision making, and there's some protective factors, especially around supportive adults, where this area is doing better than the rest of the province, and I think that's really important to sort of foster that, and it's really cool to see that happening here, and definitely something to be pretty pumped about. I'll just share with you what we're doing with the data just before we do questions. Every school district that participated got their own copy of their own data. That's theirs, but if you want to do a local, sort of confidential to them, if you want to do a local health initiative, you can go and talk to them though. Maybe you can get the real local school district data. We're doing 16 reports across the province, the Northwest being this one, but there's also a couple other ones across the north, and we're releasing these sort of in a staggered release. We're about 2/3 of the way through, but you can watch our website for when other ones are coming up. We're part of the representative for BC. They're working on their next Growing Up in BC report, and we've provided a lot of data and a lot of focus groups and stuff on that. We've got a report coming out soon. Now that we're done doing these sort of general ones, we go into sort of real in-depth topic-specific reports using the whole province data. The first one that's coming out soon is going to be the sexual health report. That'll hopefully be coming out in the next month or two. We're just working on trying to find someone to lay it out right now. And then also we're always sort of working on promoting, sort of getting this out to young people as well. So we've got a bunch of different resources. We've got this cool poster that our youth advisory group designed that's available. You can download this off the website. It's a nice big high color PDF or high res PDF, and it highlights some of the key findings that young people sort of picked out and wanted to highlight and share. We're also doing our Next Steps projects coming up, where we go into schools or into youth groups or whatever group of young people you might be working with. We do a more youth-friendly version. It's less stats and stuff of sharing the local data, and then we work to do some sort of initiative, and we have some money that we can put towards that initiative. And so if you can think of a group of young people that might be interested in sort of putting on an event or doing something, that would be definitely an email to get in touch with. We've done some posters, some videos, and then this is the other thing I wanted to just talk about. We're giving away these youth action grants. They're $500, and they're to any young people who are in school districts who participated in the survey. And basically, if you want to put on a youth event and do something to promote youth health in your area, we've already had some neat ones where someone put on like a youth TED Talks in their community. We've seen some neat videos being made, all sorts of different things. It can be very creative. I brought some applications. They're like 3 pages long. It's super easy to fill out. So if you know of a group of young people who might want $500 to do something cool, you can go to our website, but also you can grab one here. We got some neat videos from various sort of BC key stakeholders commenting on the findings. That's all on our website. We got the president of the Whitecaps to talk about our sports stats and all sorts of cool stuff like that. So that is what we're doing. Everything is on the website. Please go check it out. I know we're running a little short on time. I'm happy to take questions, but it's a really great opportunity to talk to you. And I hope when we come back in 3 years or so to do the 2018 survey, that maybe some of you would be interested in being involved in the going out into schools and collecting the data. It's a very cool thing to do, a neat experience. So I know it's a lot, and I've just been like talking at you as quickly as I can. A lot to take in, but are there any questions? Yeah.
I'll make a comment and maybe you can provide some further comparisons. The two numbers that jumped out at me were the concussion level, 19%, and also the self-harm statistics, especially amongst girls, 29%.
Yeah.
Are those unusual in this region, or how do you interpret those?
Those were not unusual in this region. The concussion one, it's tough because we've never asked it before, and I think we were surprised that it was that high. I think most people are surprised it's that high. So that's definitely one that we're hoping to get more context around. The self-harm one, though, it's been like that for a while. And among girls, it's actually going up a bit province-wide. It's not super different, I don't think, here than from the rest of the province. I think that it's interesting to see when we compare the self-harm rates with the suicide rates, there's definitely two clear sort of streams of those who are doing it and are moving towards sort of a more dangerous self-harm, suicidal thoughts, and those who are using it maybe more as almost a coping mechanism. We can sort of see that it sort of splits like that, but they're both about what we see provincially, and the gender difference is definitely what we see. Yeah.
Did you guys look at all at the gender differences between, like, for BC coroners and that for actual suicide, so successful attempts?
I don't know what they have. I believe males are more likely to successfully commit suicide, and obviously, if they have, then they're not completing our survey. So it's kind of a different, I guess, in that way.
Interesting.
Yeah, no, so yeah, in terms of the gender difference around actual, we don't, EC coroners would show you that yeah, males have higher completion rate, I guess you would say, but so yeah, that's true in terms of that, but it's definitely in terms of attempts, we definitely see almost double, and again, that's not unique to this area, the gender difference among suicide attempts for sure. Yeah.
Or the perspective of youth on their view of graduating.
Yes.
I find that very interesting because if you look at the labor market stats, this area, a lot of the people in this area, they tend to have lower success rates in school compared to other parts of the country, right? And certainly. The challenge, I mean, there's this supposedly economic, large activity going on in the north, and yet we have a hard time bringing everybody to be a skilled laborer.
Yeah.
Right? There's a disconnect there, right? So they're saying they will graduate.
Yes.
As your stuff says, but yet we have labor market studies that say that the literacy and numeracy rate for people in this area is lower, which is a disconnect.
I think what we do see that students in this area are less likely to plan to go on to post-secondary and more likely to have not made future plans. But in terms of actually not graduating from high school, it's about on par. And this is obviously in terms of what you're planning to do, not what you actually do. But it's a pretty good indicator in terms of sort of school engagement. For sure. And so I think what we would see the difference here is in that sort of planning to go on to further school, and just higher rates of just not really thinking about post-secondary yet. And this does obviously also include students as young as grade 7. So, in a lot of cases you might not see that effect that you're thinking of at that point. Oh, and I'm sorry if is anyone on there?
Nope. No questions.
Nice.
And can you just talk a little bit about some of the projects that people have done in the past, like with the Ravens Youth Group? Didn't they do some work with at-risk youth to try and
Definitely
develop some skills around doing some computer animation or something? Yeah.
So it's all sorts of differences. So we're always after every report we do these next steps workshops where we take data back and something comes out of it. When we did Ravens Children last time, there were a bunch of different initiatives that came out of it. There was one, I'm not sure if it was what you're thinking of, where they made these really cool claymation videos.
Yeah.
Maybe that's what it is. Those are all on our website, where you can, they're just these, it's really cool actually. It takes about 3 hours or so to make, with a trained facilitator, 3 hours or so to make a 30-second long claymation video. And it's the perfect sort of way of engaging young people in the data, because like they learn about it and then they latch on to something, and right there they can make this neat little video. Some of the ones from our Ravens Children report actually got accepted into an international film festival, and it was which was super cool. So that's definitely one of the examples of things that have come out of this, the last Ravens Children report. There were also a lot of different events that young people were putting on in their community. There was one Aboriginal group who created this group called FLOW, which stood for Future Leaders of the World. And what they did was they planned a day where in the morning they would learn a lot of traditional heritage activities, drum making and stuff like that. And then from their elders, and then in the afternoon they would teach hip hop and beats and things like that. And it was a really interesting day, and a lot of neat collaboration came out of it. And they've kept going with it, and it's become an annual thing. And this is in this community, and it's kind of something that came out of the data, where they saw a neat thing around connection to adults outside your family, I think was what it was, and how that was related to less substance use. And they're like, all right, we're going to run with that, and we're going to do something to it. We also saw a group from the same project, from the same Ravens Children Project, who did a session where they saw young people and the relation of peers and school connectedness and dropout rates, and they saw a link between all those, and they created a day where older high school kids they had a day where they went out and had a big day of activities with students who were just coming in to that high school and may have been intimidated and were at risk for dropping out, and there were just some neat things that have come out of it. So a whole range of stuff, and yeah, if any, I don't know who you folks are working with, but if there's any young people, we're happy to sort of work and make cool things happen. Thanks. Awesome. Well, thanks so much for having me, guys. I really appreciate it.
So if there's no further questions, I will thank Duncan. We'll have a few minutes break while we change over for so if you want to come and ask Duncan individual questions, then feel free.